Say that you have seen many sexologists, but you have not got any results. Well, first of all, you need to understand that who a sexologist is. Basically, a sexologist is someone who is scientifically trained in the field of human sexuality. So that's the first thing which you need to understand. Second thing you need to understand is what are the qualifications of a sexologist and what are the kind of studies he includes in his course of study. So to tell you briefly, a sexologist is somebody who is well versed in psychology, he is well versed in medicine, he is well versed in sociology, he is well versed in family studies, he is well versed in psychiatry, he is well versed in counseling and psychotherapy, and finally a little bit of cultural history. So finally, when he consults you about your problem, he has a very good idea about where you stand in relation to your country, in relation to your culture, in relation to yourself as a person, and even in relation to what is known as family studies. Like, he knows what kind of family you belong to, what kind of ethnic race you belong to. So those things actually help a sexologist very much when he is trying to help you. Fine. Now, having said that, now we come to your question directly as to why you have not got the kind of results which you were expected. See, basically when you go to a trained sexologist, what happens is he or she is going to take your sexual history, which is also known as intimate history. Now, when he takes your intimate history, he is going to ask you a lot of questions about your sex life. So feel free, feel very comfortable, and try to give him absolutely honest answers so that he can make a genuine assessment of your problem. Fine. So that is one part of it. The next part, what he is going to do is he is going to take your medical history. Medical history, by that I mean the kind of medical problems you have which may interfere and act as a way of helping you create that sexual problem. Also, he will check your surgical history. If you have undergone any kind of surgery, for example a surgery on a spinal column, so that's going to act as a kind of a problematic situation for an erectile dysfunction. Also, he is going to take your psychiatric history to find out whether it is stress, anxiety, or any other kind of psychotic disorder which is interfering with your normal sexual functioning. So having said that, just let me reiterate. He is going to take your intimate history, he is going to take your medical history, he is going to take your surgical history, and finally he is going to take your psychological history. And then what happens after that? After that, he is going to make an initial assessment. So after making initial assessment, the process of treating you begins. Now, three things can happen. He can either put you on medications, he can put you on some kind of exercises, or he can put you on something which is known as a sex therapy, or a combination of all of these things. So now when you tell me that you went to a sexologist and did not get any results, probably you have been to a sexologist who was not trained in the way I am talking about. So you need to see a trained sexologist. Now, how are you going to do that? The best way to see a trained sexologist would be to either ask your friends who have been consulting an expert sexologist. You can take their recommendations. Else what you can do, you can call up some customized telephone services who would give you a list of people who are expert in the field of human sexuality, and then you can go and consult them. So these are some of the ways of going about finding a right sexologist. So I would advise you that when you are trying to find out a sexologist, make sure that you keep these things in mind. Do not hesitate to ask the qualifications of the sexologist if you have to. He could be a medical expert or he could be a PhD in human sexuality. Either of them is fine. And I think once you go to the right person, you should be absolutely fine.